the moms of liberty, what is your issue with kids wearing masks? I mean, everybody says it, medical community says it. I wear a mask all day in surgery, so does Dr. Nita. Before COVID, there's a reason why we wear a mask. We know that it prevents the transmission of infectious communicable diseases. So Tina, tell us your big issue with masks.
The one thing that we are experts of as moms is our children. There's no one that knows my child better than me. And it is my responsibility to be his voice and protect him and step up for him. And that's what moms everywhere are feeling. We started gathering, we went through a system where we started gathering stories of parents that have concerns with this issue. And the stories are heartbreaking. Everything from coming home daily with headaches, all the way to anxiety, panic attacks, depression, suicidal thoughts, and then move over into the more physical health and not the mental health. You're going to hear from one of our members in a minute with what her son experienced, but we have kids with MRSA on their face, and we have kids with staph infection. You name it, there's a number of things we're watching our kids struggle with. Some are very serious, and no one seems to be listening to that. No one seems to be taking that seriously. And these are our children that we are here to protect and defend, and we need our voices heard on what's happening to them.
Well, Tina, I would never dispute the fact that you know your child better than anybody else, but all these evils that you claim are a result of the mask, and it's just not so. There is no scientific, historical evidence to support that. And, you know, my big concern is it seems like you don't want your kid to wear a mask, so you're sort of dictating how you want your child to think about wearing the mask, and almost, you know, planting these seeds of all these things. Oh, you're going to be uncomfortable, you're not going to be able to breathe, you're going to get infections on your face, it's going to give you a headache, all of these things where, you know, the power of suggestion that it would appear to me is taking place here is concerning.
Yeah, I hear and understand you. I'm not sure how you medically just throw out the argument of the actual things that are happening on our children's face. And you're going to hear from Sandy, one of our members, in a minute, of a diagnosis, of a physical diagnosis of mask mouth, which I had never heard of, that her dentist gave to her child. And we have pages and pages and thousands of parents that have come to us with medical diagnoses where their doctors, their physicians have said, this is a result of the mask. That's not me at home telling my kid, you know, be afraid of a mask. That is a doctor saying that what they're dealing with is because their child has worn a mask.
As a board certified ear, nose, and throat physician and surgeon, you know, the mask mouth, dry mouth, I don't deny they don't exist, but there are great ways to prevent those conditions, and if those conditions do develop, you can treat them so that the problem essentially is kept at bay.